Hello and Assalamu alaikum. Ultrascan diagnostics here. This is the high resolution endo mode CBCT of the lower right hand quadrant. The area of interest is the lower right first molar. The lower right first molar is root canal treated, which can be seen on the sagittal view. Here we can see that the mesial root, this is the mesio buccal, the mesiolingual, and now this is the mesiobuccal. There we go, and you've got the distal. So there are quite a few interesting things about this case. I'm going to take you through each and every aspect of this tooth individually. Now, if we look at the tooth from a transaxial point of view, on the transaxial view, we can see that this tooth has two canals in the mesial root. Both the canals appear to be very well obturated. We've got this right here. This is the mesiolingual canal, which is slightly shorter. Then we've got the mesiobuccal. The mesiobuccal has ciliar extrusion, which can also be known as a ciliar puff in this region. We've got a slight leakage here in this region, which can be taken for a crack, but we don't see this crack propagating through, so we won't classify this as a crack. Now the interesting bit is in the distal root. So the distal root has one major canal which we can see is obturated, but this has a lateral canal here as well. I'm going to zoom in for our kind doctor. It's going to be very difficult. We're at 75 micrometers of slice size. Here we can see this is the additional canal. This is a 1-to-1 configuration. There it can be clearly seen. There we go, a 1-to-1 configuration. This root has a slight apical delta at the apex. We will show you each and every view. This is the axial view. On the axial view, we will be able to see that this is one, and initially this is one canal. As we move inferiorly or we move down, we can see that this is the mesiobuccal canal, and then this is where the mesiolingual is present. There we go, right? So this is where the second canal is partially missing right here. There we go, right there. So we do have area which has not been obturated in this tooth, which can clearly be seen on the axial view. Now I'm going to show you this on the sagittal view. On the sagittal view, we can clearly see this is the part of the root which has not been obturated or which has not been cleaned out. So this is something that we can see, that the distal has a 1-to-1 configuration, and this is where the canal has not been cleaned out. But the remaining part which can be seen here, the distobuccal canal is completely obturated all the way to the apex. We do not see any very apical radiolucencies. No pathologies can be seen. We can't see any J-shaped radiolucency, so we can't comment on any fractures or cracks. If we look at the tooth from the superficial side, so we've got a little bit of a distal portion right here. We can see a little bit of opening here distally. So this could be a cause of concern, but the crack does not, or the problem does not go subcrestal. So if there are any further questions regarding this case, please feel free to reach to our team. Thank you very much.